All right, so we are at 1 p.m. Central Standard Time. I know that varies for folks depending on where you are. So let's get started. I know working in food service, we have limited time, especially during this time period. So I do want to be just cognizant and respectful of your time. And so we truly are grateful for the folks that are able to join us on this webinar. Our last webinar was about data reporting analytics. There is a recording available. So if you are interested, please feel free to reach out to Jason, Ricky, send an email to sales@csense.com and we can share that with you. For today's webinar, I'll go ahead and introduce it. I'll just kind of spend a couple minutes here giving some housekeeping, just some good to know in terms of engagement for the webinar. And if a few folks pop up, we can at least have an introduction without going into the content right away. But I do just want to take care of that right away. My name is Pau. I am the marketing manager here at Common Sense Solutions, really just helping to kind of facilitate the webinar and run it. But the content experts are going to be Jason and Ricky here, who I will introduce better in a little bit here. With that said, today we're going to talk about kiosks, mobile ordering, and tablets, and we're really excited for this topic. In terms of what we'll be talking about, we'll have about 30 minutes of content, and then at the end, we'll reserve 10 to 15 minutes for Q&A. So with that said, there is a Q&A feature to submit questions, so feel free to use that. We'll go through them in the end, and if we don't have all the time, we can definitely reach out individually and provide you a response. The webinar will be recorded and be available for reviewing after, so you are more than welcome to share it. We'll have more webinars in the future that will be recorded and saved on our website as well. So we'll have a repository if you are unable to join us for future ones, but that's a good to know. And then lastly, we do send out post-event surveys. So really just to kind of gauge your feedback and your input regarding this webinar, how did things go, but also future content. What are you interested in? What can we help put on in terms of information? And what can we provide expertise on? So that also allows you a chance to win a $50 Amazon gift card for your feedback and your time. Yeah, with that said, sorry, I'm just going to admit a couple more folks here. I'm going to introduce our presenters. So our last speakers were Jason and Ricky, and they're the same presenters for this webinar, and both have done a great job in the last one, and I'm really excited for them to share their expertise around this topic. Jason and Ricky have individually over 15 years of experience working with customers in the food service industry or food service team, both for healthcare and senior living. So I know we have a good mix of folks between those two industries. And definitely in the last 4 years here with COVID and whatnot, they've seen a rise in the discussion around kiosks, tablets, and mobile ordering. So that's going to be them really sharing their expertise on this call with you. In terms of our agenda, we're going to have kind of a two-part, break this down into two parts. So Ricky will be talking about some of those dining challenges, kind of the landscape of where traditional dining is, and the impacts on your operations and your revenue. And then he'll pass it off to Jason to talk about what are those solutions, like how is a kiosk, a mobile ordering system and tablet going to help combat some of those dining challenges that Ricky's talked about. And he'll give you some best practices, and then we'll end with Q&A. So with that said, I don't want to take too much of an intro here. I'm just going to pass it on to Ricky and yeah, take it away.
Hey, thanks, Pal. Here today, we're going to talk about all the challenges that we're having and maybe some helpful tips on what we can do with some things that can be added. The landscape since COVID-19 has changed the food service industry. So over the last 4 years, it's totally different to me, and I know that you've seen that. A lot of things changed, such as safety protocols, social distancing, physical barriers, and limited capacities. It's changed during the time of COVID, but that's been kind of lax now. But then we still have some of the things that have remained that changed during COVID that people kind of liked, such as contactless and ordering and payments, such as mobile ordering or picking up from the location or having deliveries made. And so that's been the challenge of changing the food service to keep some of that. For instance, as you see there, 2/3 of consumers choose food service. Sorry, choose self-service for faster checkout, and 80% feel comfortable with pre-ordering. So sometimes the pre-ordering is a thing that's become a norm at home. And so when they're in the hospital or they're in their apartment at the community, they're wanting that same benefit there. Just to give you some numbers, on-premise spending before the pandemic in 2019 for traditional dining was $12.1 billion. By the early pandemic, which was about the middle of 2020, spending was down 80%. And by the end of it, we're going to say the end of 2022, on-premise was only back up 60%. So the traditional dining, the spending itself for traditional dining was only back up 60%. So we still weren't at any pre-pandemic numbers. Some of the expectations now for the consumers are like 70% prefer food, ordering the food online and want it delivered. The food quality, now there's so many choices that you can choose from whenever you choose mobile ordering from DoorDash or Uber Eats, Grubhub. I can order those anytime I want it from wherever I want it. So, tonight I feel different. I don't want the normal meals that I may get that's home cooking, and I may want something exotic or what have you. And so I have those capabilities now with what I did during the COVID era time. And then the personal experience, 33% will not order somewhere that they can experience the way they want to experience it. So if we break that down to our consumers within our industry here, we break it down into the staff of the location. So it would be the employees of the hospital or the employees of the community. We broke it down into patients and residents. We combined the two because basically that's our customer, the patients of the hospital and the residents of the communities, and then visitors. So any guests or visitors that would be there. So breaking that down by customer, the staff, they're working longer hours. 71% of the staff now take less than 30 minutes for a meal break, and 25% of the staff will usually eat at their desk or their work area, and may not even come to a cafeteria or a dining area. They are now with patients and also residents, they're wanting room service. In hospitals, I know within the next 3 years that 45% of the hospitals that currently do room service, and most of the time it's a call-in room service or maybe order bedside with somebody that's taking your order. In 3 years, they want it all to be where the patient can order for themselves and they can order from their own device. Same within senior living, a lot of that mobile ordering from their room, they would like it when they want it and just order it themselves instead of having to go down to the eating area. But then there's plenty of people that still like eating in that area too, but we have sped up some of the processes. There's less choices whenever you're in some of the places post-pandemic because some of the meal times have changed. Sometimes places have closed or started closing for dinner maybe. My dad was in the hospital earlier in the year, and I had to eat from a vending machine because there was no warm food in the hospital that I could buy from. So it was like there wasn't any choices for me as a guest, as a visitor. You know, the self-service vending machine was great, but you know, if I really wanted something hot, I could have went elsewhere. But there wasn't anything offered for me there. And impacts on the staff and that that hurts you is like hiring and keeping employees is hard. You know, the finding the employees and just managing your labor, getting shifts, finding people to serve food, and finding people to help deliver the food. That can be hard. Keeping the right inventory. You know, during the pandemic, there was a lot of things that weren't available, and some things got old on the shelf, and you were having to serve things just as you had it in stock, and sometimes that made people want more. You know, just wanted additional choices. With the patients, processes improved, such as room service and delivering meals. Sometimes hospitals went off of room service and started delivering meals that were just pre-made, that weren't necessarily to order, but the processes improved during that time, and that's come forward to today. Also for residents ordering, a lot more choices have come about, but they still want to be able to easily get their food. During that time, hardware and software was added to help with these processes, and it's continued now. And then with visitors, with the increased security that's in a lot of both communities and healthcare, sometimes that causes some challenges. And some communities have had to add POS that didn't have POS before, because they're feeding guests and see that as a revenue center. They see it as money that they can take in. And now that they're seeing it as more revenue, some people are doing third parties, and that's a chance for us to say, hey, let's keep it within house here. Let's just try to do this for all of our members, patients, and their guests. So the impacts on the bottom line is that lower employee spend. If you don't have some of these choices that we're talking about today, you may be losing some money from the employees that are eating or that are available to eat in your facility each day. The residents and the patients in particular, there's lower admissions because you're looking at a lot of outpatient procedures that are being done now, and then inpatient days have been cut again. So that keeps lower, and so there's lower patients to feed and more duties and staff that you have to keep up. With residents being able to choose food outside, they got used to ordering from, like I said, Grubhub or DoorDash, and so they liked the different choices they have. So it kind of makes you think internally, should we make more choices? What can we offer? And they could eat in their room if they wanted to. They usually have a kitchen or a kitchenette that allows them to cook themselves, or they can just continue ordering inside. And same with the guests and visitors, they can just bring it in from outside. They could even feed the patients, sometimes feed their family member if they wanted to, because they wanted, some chicken, for instance. And then it calls for a lower spend there too. Now that we've analyzed all the demands that have been created and looking for all these changes, I'm going to pass this over to Jason Bradley to kind of describe what all you could do to help with those choices.
Well said, Ricky, and I appreciate it. Definitely, we appreciate everybody's time today. So what I'm going to kind of go over is 3 different technologies: the kiosks, the mobile ordering and tablets. And maybe some of you already have these technologies. That's great. Hopefully it was very easy to implement and they're working out perfectly for you. I think we all can agree that we have to utilize technology in food service today to keep up with what's going on in the times, but it's also got to make sense for your organization, right? One funny story I have is I was here locally at a Subway restaurant, and I go by this Subway every day, and I noticed that the drive-through line was just packed every day, cars lined up. And one day I went through the line, and there was nobody in the drive-through, but the parking lot was packed, which never happened. So I was like, well, this is curious. So I went ahead and pulled in the drive-through, excited to get my order quickly and get on my way, get my lunch. And I realized they'd replaced the menu board with a touch digital menu board that you had to touch to get your order. So I imagine this disoriented some people. The other challenge is if you're like me and you go to Subway, I like jalapenos, but I only like a few jalapenos, like 3 on my sandwich, not a handful. So I went to order jalapenos, but I couldn't do that. So there was no interaction there to get my few jalapenos. I pulled around to the drive-through and asked the cashier, I said, do you like this new menu board? And she's like, yeah, it's great. And I'm thinking, well, yeah, because you've got nobody in line here doing anything. So the point of my story there is, definitely Subway thought through and said, man, technology is great. We need this. Customers want this. This will increase our return on investment, our throughput. But really, it was the opposite. Now everybody's going inside to place their order. So technology is great, but we have to make sure we're thinking about the decision and how it's going to impact our organization, right? So again, first place we're going to look at is the kiosks, and where do we want to deploy these, and where are we seeing these in hospitals, senior living, in different areas that we especially look at. Number one is for the kiosks is the grab and go. So especially with the shortage of labor and everything, we're seeing a lot more demands for the kiosk where employees can go grab some items, scan them, and either scan their badge or pay the credit card or whatever and go. They don't have to have somebody there, a cashier standing at the station, costing them money. A lot of times they're actually barcoding maybe fresh sandwiches or things like this. But anyway, the residents or employees go grab these items, bring them up, and get on their way. Very quick. And especially like Ricky said, after COVID, this has been more and more, wanted out there in the market. Another place we're seeing is cafeteria. And I think cafeteria years ago, we thought of just checking out people, but they're also being used to actually order food. So maybe I've got a couple kiosks at different stations. And when I place my order for my burger, it goes to a grill. It's made fresh there. They can put a sticker on it for the employee or whatever, or for the senior living facility. So there's really 2 different places we're seeing those, the checkout as well as the food ordering in the cafeteria type settings and the gift shop. So maybe my employees or residents are wanting just to grab some items like some aspirin or some chips or whatever, and they can go in the gift shop and use those as well. So that's kind of where we're seeing the kiosks mostly being used as far as the food service. I'm sure they're being used for other locations of your facilities, but that's what we're talking about, food service today. As far as the mobile ordering and browser-based ordering, definitely the grill area, of course, that we are used to, where I place the order and it's being sent to the grill. They make my order and it's waiting for me when I get there. Another huge ask we're being asked for is for coffee shops. A lot of people like the idea, especially like the Starbucks of the world, where they can just go on their app, place their order for their macchiato, latte, whatever, and skinny. And when they get down there, it's right there with their name on it. They can just grab their coffee and go. The other place, again, is micro markets. We in particular have a pretty cool app where it's got a barcode on it. And we'll talk about that in a minute, where employees can actually scan, either employees or residents can actually scan that barcode and actually use their phone to pay for those items. So it's pretty cool. As far as the tablets go, line bustings, where you see a lot of these tablets, especially in the busy cafeterias. If you've gone to like a Chick-fil-A, you might have seen use these in line with your cars where they're just trying to get the line moving. Table side ordering, I know some of you are already using this, but just getting in front of that resident or employee, taking that order table side, be more interactive with them. And then en route ordering, where we're going around to the rooms. And as Ricky pointed out, a lot more hospitals are looking to go to this in-room ordering where we're in front of that resident or patient, taking the order right in front of them. Okay, there's going to be some stats pop up here. You can see kiosks can increase average order by 30%. Really, this, and you're going to see also with the the mobile ordering, this can be 20%, but it's really just having a captive audience of that person be able to sit where they're at and order on their own without someone waiting for them and staring at them and waiting for the order. So you can give them a little more time to order if they want to, or look at the menu a little more. The pictures definitely help to increase those sales as well as if you have some pop-up add-on stuff. So I get a burger and it pops up and asks me if I want fries or something. That'll help increase those sales as well. As far as the kiosk, we got labor savings. I think we all know this for the most part, that with and I also want to point out that maybe this isn't labor savings as far as replacing a full-time employee, but maybe reutilizing those employees at different areas of our facility where maybe we need them a little bit more. So labor savings, we don't have somebody there manning that station. Non-traditional ordering is another huge place where we're seeing this, to where maybe we've got our facilities don't run from 9 to 5, right? Like the movie. Our facilities are running after hours. You got people there all the time and they're hungry too. So maybe we've got a cashier during the day. We turn that cash register into a kiosk at night where the employees can go ahead and grab their items, scan them, and pay for them there or be payroll deducted. Another place we're seeing this is where we don't have the actual cafeteria, totally staffed. However, in the behind the kitchen, we can have employees go in and place orders for hot meals, and it prints back to the kitchen so they can make those for those nighttime employees or off-hour employees. Order accuracy, this is going to be the same with the mobile ordering as well. If the customer's placing the order, then it better be pretty dang clear and accurate, because they're the one placing the orders, so it should be accurate. The other place we see with kiosks is a lot of these have the ability to put messages on them, so you can do some marketing, whether that be to sell higher margin items, whether that be to try to sell items that maybe are almost end of life, or if it's just to do marketing for our facility to say, hey, we have this event coming up, we got a blood drive coming up, just doing some marketing for our facilities. As far as the mobile ordering goes, you can see here, again, we talked about increased revenue, and Ricky had mentioned that 45% of healthcare organizations plan to offer digital room service in the next 3 years. So thanks for that stat, Ricky. Some other benefits, again, we talked about self-ordering. So our employees or residents have the ability to order when they want to, at the leisure of when they want to, with no one trying to hurry them up. Order accuracy, we talked about. Convenient pickup. So now I can come pick up my food and it's ready for me. How many places do we see doing this nowadays? It used to be Panera Bread. Now it's a lot of places where you just see a whole area where they can just come pick up their food when they want to. There's no rush. Throttling in waves. So this is about, maybe my kitchen can only handle 5 additional orders every 10 minutes. Well, you can set our system to do this and talk to your point of sale provider if you don't know if they can or not. But this way, we're not overworking our kitchens. We're not, so that what this basically means is, once I've got, let's say, 5 orders in a 10-minute window, it cuts off the ability to order any more during that time period. So again, my kitchen just aren't getting overworked. So that's convenience there, benefit of being able to throttle those orders. Increased orders, we're going to be getting more orders as well as a more dollar amount to those orders. Combat third-party delivery services. I think we've probably all seen a lot of this taken away from some of our revenue, where people order the DoorDash or Uber Eats and all this. Well, if they've got the ability to order from your app and order your food at their convenience when they want it, they're less likely to go out and use maybe one of those third-party apps and keep that money in-house. The other one I mentioned was the in-app barcode scanner. If you're interested in that, we could definitely discuss that more at a different time, but it basically allows you to use your phone's camera as a barcode scanner to scan items just like you would a kiosk and pay for them with a credit card or a payroll deduct. As far as the tablets go, that stat was just about, and if you need those stats more, just reach out to us. I'm sure Pal can get them to you, but I'm sure you've seen the tablets on the tables, the bar side, where you can order. People are adopting that much more, especially I think after COVID. But you got faster order times. So now I can go to a table, I'm right in front of the resident or employee, and I can take their order right in front of them, kick it back to the kitchen, and it's really going to, increase our turn times. Again, faster checkout. I can be right there at tableside and check out those people as well. Less mistakes, since I'm placing that order right in front of the person. I'm less likely to transpose that information, take it over, walk it over to the point of sale system, and put it back in and maybe make a mistake and not remember what they said. How many times has that happened to us where the server's forgotten what you said from when they walked away to 2 minutes later and come back and ask you? Another one with the system, especially in senior living, would be account lookup. So I know with our system, you can actually look up the residents, see if they've got any allergies, look up birth dates, anniversary dates, common information like that, that maybe you want to know, that I can pull that up right in front of the person and really have a good conversation and know something about them. The other one, of course, is shorter lines with the line busting. If I can get in there and people sometimes see those longer lines and they walk away. Well, if we've got shorter lines with line busting, they're more likely to come eat in the cafeteria or wherever and stand in a shorter line. So things to think about with setup and configuration, kind of like I said with Subway. Obviously, they thought about the solution, but maybe they didn't think about exactly how it was going to work where they're doing it. So with all these, you're going to kind of see the same theme as far as keep it simple. What does that mean? It means limit your modifiers, limit your menu offering. Do I want to put a extra large pizza with 20 different toppings and 100 different modifiers on a kiosk? That's not something I would do. I would offer maybe a pepperoni pizza, a cheese pizza, and a mushroom pizza or something, So think about that when you're building out your menu for your kiosk. Pictures are worth 1,000 words. Pictures can go a long way on a kiosk or even like a mobile device when you're doing that kind of ordering. They can kind of see what they're looking to get very, very quickly without having to read through all those descriptions. But think about traditional versus freestanding. What I mean here is, nowadays, we have the ability to take those cashier stations that are being utilized during the day and actually turn those into self-service kiosk mode at off periods. So is that the way you want to work with your investment? Or do you want more of a freestanding like you're seeing there on the picture, where it is more freestanding, the printer's contained in it, you can have different things like barcode scanners built into it. So it's all self-contained, aesthetically a little more pleasing. And there's less pieces laying around. So which one? Of course, there's price concerns with each one of these as well. So just some things to keep in mind. As far as a podium versus countertop, you can see there on the picture that's a countertop. Or do you need the, we have like a 3-foot stand that we can also basically a podium to hold that up. Do you need that to be face level, or do you have a place you can put this on a countertop? So it's some things to keep in mind on that. And then landscape versus portrait. How do you want to face your screen? Would it look aesthetically more pleasing if we had it landscape or portrait, or how do you want to set that menu up? So just some things to think about with the kiosk. As far as the mobile ordering goes, again, keep it simple. That's going to be a common theme. Keep it simple. Again, let's go with easy to make items, maybe items that don't take a long time for my kitchen to make, that are kind of easier to work with. Some chicken fingers, that kind of thing. Just easy for my kitchen to make, especially if it's off hours. Set those ways we discussed. Have some good descriptions. So if an employee or a resident does have a question about that, now they can go in and read the descriptions of those items, what's actually on those sandwiches, those type of things, what they come with. Make sure you have some good modifiers. Think about the modifiers you need to have with each one of these. So do I have the ability to choose my salad dressing, of course, or ranch dressing with my mozzarella sticks? Any good notes? So any other notes they need you to know that maybe wasn't clear in the description, or they just need for the kitchen to know, that can print off in the kitchen. And then hours of use. Does the system have the ability to do day parts? If you have breakfast, lunch, and dinner, where I don't want them to be able to order breakfast during lunch, so it automatically cuts off those times. When do we need the different day parts to cut off from our system and stop taking those orders? So some things to think about when it comes to the setup of your mobile device, mobile ordering, I'm sorry. And then as far as tablets go, this is one of the biggest ones. I think back when I started about 14 years ago selling point of sale in the food service area, I really wanted to sell tablets. I just saw how great they were and how much sense they made and how much time they could save. But what I wasn't thinking about was the conversational ordering setup. And what I mean is, if you think about the older point of sale systems, and maybe you have one of these, traditionally what you do when you go table side is you ask the customer what they want. Maybe they want a New York strip steak, and they can tell you what all they want on it, what they want for their side. And then you go back to the point of sale system, and it would first ask you what? Okay, I want the New York strip. It's going to ask you what temperature I want my steak, right? And then it's going to ask you what side you want. And then it's going to, let's say I want a salad, it's going to ask you the dressing. Well, you can't go in the system and say, I want a New York strip steak and I want ranch dressing on my salad, because you had to place the order as it dictated it to you. When you're in front of a customer, you can't do that, because they are going to give it to you as they want it. So maybe they're going to say, I want a New York strip steak, but I want that ranch dressing on my salad. So you need to think about, before you build out the menu, or your person does, that it's got to be tabular or modular, where I can get back and forth between those options very, very quickly, instead of saying, wait, hold on, sir, ma'am, what temperature do you want your steak? So it just makes it more interruptive and not as a good flow for the whole process. Simple modifier setup, kind of like I was saying. Easy page transitions, again, goes along with that as well. Can you get all the modifiers on one page? Do you have to go to different ones? Really about, saving steps here. As far as the tablets, think about device and weight. I've seen the size and weight. I've seen this be a problem. It used to be we had the 10-inch tablets and they weighed, heck, 15 pounds. And you think about someone serving tables for 6 hours or something with a 15-pound tablet. Well, their arm's going to be huge, right? Like they're at the gym every day. So think about the size. The smaller the tablet, typically the less weight. So think about that. But also think about the font and how big that's going to be on your screen, if it's going to be legible. So some things to really probably reach out to your point of sale or the manufacturers and make sure you're getting the right devices for your needs. Peripherals. Are we going to need printers? Do we need barcode scanners? Do we need badge readers? So peripherals and accessories, think about those. Do those have the right ports that we need to plug those items into? As it says below, do we need a stand to, if it's not portable, do we have a stand we need to put this into to where we can get cash drawers, we can get printers, we can get all these other items plugged into it. So a lot of times with tablets, you have a really limited amount of ports. Think about a case. Do you have a rugged case? If you drop test this, or if you drop it, how many feet is this drop tested from? 3, 5 feet. So I would definitely recommend a ruggedized case, and then a lanyard. We can tell people all day long, these are items, these tablets are going to be dropped, they'll break, but it always inevitably happens where we're having to replace these out and people aren't very happy. So I'd recommend getting a lanyard for these tablets. That way, when your employees do drop them, then it's not going to fall all the way to the ground and hopefully not break. Other thing to think about, a lot of times these tablets might not have as much memory as a point of sale system, which your POS terminal, which your POS system might require. So just make sure you're getting an accurate amount of memory for your point of sale system. And lastly is look at the warranty. Do they have an extended warranty, maybe like a 3-year no fault warranty, which we can offer, to where you really don't have to worry about all that. And if it breaks, we know we can replace it, not have to come out of our budget too high with that. And then consideration, these are things we always have been going through with our customers, and I know we've learned a lot over the last 10 years or whatever on these. Definitely we've gotten better at it. Device count, we say we can kind of replace or the kiosk can handle the duty of 1.5 full-time employees. So can it? Think about that. Think about the capacity and traffic, how user-friendly it is. And another thing I recommend is, and I've seen this in a couple places, is when they adopt the kiosk systems and they're taking out cashiers, to go ahead and possibly have a floating staff member to go around to the different kiosks and help out those customers, or maybe employees or even guests that aren't usually using the systems, and help them answer any questions, ring out things. In the first few weeks, if you can have a floating staff member to help train your people, then you're going to have a lot more success with the adoption rate of your kiosks. As far as the mobile ordering, think about the platform app. Is it a mobile ordering place where they have to go out to a link or a site or scan a QR code to get to it? Or is it an app that your employees can download and is just part of the system? How easy is it to get to the website, or is it an app that's just they can download, which is going to be easy to get to? Integration with current point of sale. So does it integrate with your current point of sale, or is this a third-party application? Of course, the benefit to integrate with your current point of sale is you've got one database to manage, versus if you use a third-party application, you've probably got 2 databases to manage, as well as if you get 86th on an item, you're going to 86th out on both of them, as well as where is it printing to? Usually with a built-in to your point of sale system, then it's going to print to the same printers or kitchen displays you've currently got in place, versus a third party, which I'm sure you've seen, where it's printing to another printer that maybe isn't looked at as much, and maybe orders can get lost. And then think of the capabilities and limitations really of your facility. What is unique to your facility versus others or what your needs are. Obviously, this is not cookie cutter, especially with the industries that we deal with senior living as far as acute care and hospitals, very niche markets. So think about, is this system catered to what we do, the hours we work, and the support that we need? So really think about those. As far as the tablets, again, device count is huge. Maybe it's not a one-for-one server tablet, per server. Maybe we can cut down on that. Maybe we don't need as many tablets and maybe as many servers as we did before, because we can get those turns faster and get to more people in a less amount of time. Think about your maximum amount of staff, though, that you would need. So not just the normal day-to-day staff. What is a maximum number of tablets that we need for my maximum staff? Think about battery life. So typically, I think our tablets have around a maximum battery life of around 6 hours continuous use. So if you've got staff members using them for 8 hours straight, you maybe need to think about buying extra batteries, extra tablets, or some of the tablets that are out there in the market have what's called a hot swappable battery, where it's got enough internal battery to where I take this battery, pull it out, and have another one charging. I can swap that out and not lose any service whatsoever. And then think about like team service considerations. I'm sure a lot of you know what this is, but team service is where, okay, I've got 8 servers, 4 tablets. 4 of those servers are going to go out and service or take orders and check out my customers, and the other 4 are going to be kind of food runners and help drink and food run and everything, do that. And then mid shift, they go ahead and flip. So now the other person's taking the orders and the other server is doing the food running and everything. At the end of the day, they're making the same amount of money. They split the tips, and it really just helps make sure your customers are being taken care of. So that's something to think about. So I think the bottom line is, where do we start? We'll go out and analyze your needs, see what your needs are, see where you probably have an idea of where you can affect your business and help with your organization run a little more smoothly. So look at your needs, get some feedback from your workers. Probably a lot of your workers and your people you work alongside with probably know, or you can kind of talk to them and agree to where you do need to make some changes. That also is going to be, if you include those people as well, it's going to, again, help the adoption and make sure everybody's happy with the changes you do instead of trying to fight it. Define objectives. So write down what you're trying to accomplish. That way you can really see what, you've got 3 different products here. They do some similar things. Let's find out what the objectives are so we can find the right solutions for what you're trying to do. Determine return on investment. We've given you a lot of good stats here, but reach out to us. We can get you a lot more. But before, of course, you go to management, you probably need to know what our return on investment is to be able to help sell these technologies. And then please, I know Ricky and I and our team love this. Engage your point of sale provider. We've got a lot of background in this. We can help establish some best practices with you and just let you know what's been our other customers have been doing and what's been working and what's not been working. So that's about it for me. How you want to take it away?
All right, sorry, just getting a few seconds to readjust here. All right, thank you, Ricky and Jason, for both going through kind of the landscape at this point in time for a lot of our customers and things that they should be aware and look out for, and then ways in which, if they already are using a kiosk mobile ordering or tablet, how can they review and revisit that investment, or if someone's interested in implementing that, how do they go about doing that? So I thought that was great content. I'm hoping that our audience feels the same. We have a few minutes at the end here for questions. So what I'm going to do is look through some of the questions that have come in. If you would like to throw in a question at this point, you are more than welcome to. Let me just pull up here the Q&A section. I think, Jason, you talked a little bit about adoption here. So there's a question, is there an adoption period for kiosks and mobile ordering, specific categories or ages that are maybe resistive to it? And
well,
anyone
like Ricky said, I think we're on the right track with adoption of these different technologies. I think we're a little slow to adopt, slower than maybe we wanted to be. But with, like Ricky said, with the pandemic, that really pushed us forward a lot. So I think it's a lot more, people are a lot quicker to adopt these technologies than they were. And then I think the biggest thing too is people are going to be afraid of change always. If you can help get them excited about the change, maybe get some super users to help people out. And like I said, some people floating around to help use these technologies, that'll help the adoption rate, as well as making sure you set these all up correctly. They're easy to use and just keep them simple, I would say would help that adoption rate.
Great. Let's see, this question is regarding the resident lookup feature. So does your resident lookup integrate with any electronic medical record systems? I don't know if that's specific to ours or if in general you guys are aware of, solutions being able to do that.
On ours, we do have different interfaces. We offer HL7 interfaces. For senior living, we have an interface with point-click care. We have file interfaces to where we can, file interfaces allow us to integrate with any challenges we may have with some systems that have a setup API, that's their own or something. But we've been able to integrate one way or another with every system we've ever come in contact with, I believe, other than old mainframe systems. Those were horrible, expensive, but yeah, we can do that.
Jason, anything to add to that, or Ricky covered?
No, I mean, we've got quite a few different systems, point of sale systems and patient room service systems. So we probably need to get a little more granular on that if they need to.
Okay, cool. So this question is regarding in-app ordering. Does in-app ordering have features for sight impaired guests? So things like voice ordering? Any awareness of that?
I know a lot of that's being discussed. Today, you can add photos and change a lot of descriptions, and kind of it's a basic way that we set it up, depending on the platform, because the apps we have are both there's an Apple one for the App Store and one for the Play Store for Google as well for Android. But we are looking to advance in that, and we're also looking for ideas from our customers to tell us, what they'd like to see in those products. Not just those, but for the sight impairments, for sure. That's been a question that's been asked several times within the past month for just me.
I think some of those capabilities or if I'm not mistaken, or if you're using your phone and you've got those features turned on, that could be some components of your phone set up as well, maybe.
Okay, great. In terms of, let's see, kiosks, can you provide an idea of the average reduction in wait time?
Did you mention that, Jason? Is that you said wait time?
Yeah, so can you provide an idea of the average reduction in wait time with a kiosk?
Well, I think they say that it can displace 1.5 full-time employees. So I think it would be that much faster to go through the line. I forget what the actual stat is on that, how much faster it is. Like, I can look that up for you if you want to go on.
Yeah, and I think, you kind of hit on some of the points, right? There are some factors that would impact how fast someone would use a kiosk. So setting up modifiers, not having it too complicated. I would assume having it more simple would get someone through that and the turnover a little bit faster. So hopefully that answers that question. And then
and I know,
let's see.
How I know on the that is for the kiosk, that it depends on how long it takes to prepare the meal, or if it's just grab and go items that we can just stack into a bag and then hand that out, or if you have to prepare a steak, or if you have to prepare a chicken versus a hamburger, maybe, because they have to be prepared. But with the mobile app, that's another choice for pre-ordering, to where I can order it and then select the time to come pick it up. And with that time, and our system, I know that we have it to where it's already set to where if I order something now, I can program it to give me a 20-minute lead time to where I can't order for the next 20 minutes. That way it gives it enough time in the kitchen or at the grill to be prepared.
Awesome. Okay, great. And then I think, Ricky, just one thing that I was thinking about from our last webinar when we were looking at data is we did see that kiosks pretty much was a number one, the cashier, right? I think that was, one of the things that we noticed with a lot of customers that have kiosks is their kiosk is their number one cashier. So just kind of something to think about and to bring back from our last webinar.
But they're also
right,
24/7, right? So
yeah, right.
You may not have to have a cashier after hours to take the orders, but you still have to have someone to prepare whatever there. But yeah, the kiosks do take over. I mean, as far as like being your number one cashier.
Yeah, I mean, I of course, place I see it most too is like when I go to the grocery store, and you used to see, several years ago, you didn't see a lot of people using the kiosks. Maybe it was the younger generation using it, but now I go in there and there's all range of people using the kiosks. They know a lot better how they're doing it, except you get that one person that has the 50 items in their bag and they're going over them once at a time, and then they're trying to ring in their bananas. But that's you, pal. But my point is that we are seeing a much greater adoption rate. I think from everybody you see versus 5 years ago.
Yeah,
and we in our industry see usually a 3-year progression to where if something's introduced in restaurants and non healthcare senior living areas and it's introduced in restaurants, we see it in our markets about 3 years. So that would be right now for sure.
Yeah, that's helpful. And I'm hoping that the audience, you guys gained something, whether again, you have a system in place as an alternative ordering solution or something that you want to have a deeper conversation about. We welcome that. I know we're a little over time, so thank you for everyone who's kind of stuck around to the end here. We'll have an event, a post-event survey here coming out, if not by today, then Monday. Take a look in your inbox for that and provide us your feedback. And we look forward to having you join us on future webinars. But with that said, I think we can end it here, and just want to thank everyone again for your time. So have a wonderful Friday and a wonderful weekend.
Thank you.
Thank you, Ricky.
Thanks, everyone.
Jason.